You are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donica Moore. It's great to be here, but I have a question for my audience today. What do Maria Shriver, Leeza Gibbons, Marcia Gay Harden, and Nancy Reagan all have in common? Give up? They all cared for loved ones with Alzheimer's disease. Often just called Alzheimer's, it is the most common form of dementia, a progressive disease which causes a decline in thinking, memory, and language skills. It's associated with physical decline as well, and significant lifestyle and healthcare challenges. While the cause of Alzheimer's disease is unknown, risk factors include aging, genetics, family history, being overweight, and vascular disorders. But the number one risk is being female. While the onset of Alzheimer's disease is usually gradual and begins after age 65, there is a form of early Alzheimer's that can begin as young as age 40. And of course, the course of the disease varies significantly from patient to patient and over time. The incidence of Alzheimer's disease is projected to triple in the next 50 years. People aged 85 and older will be the most significantly affected. And of course, because of the gender gap in this population, this means that women will be disproportionately affected, both as patients and as caregivers. Now, Alzheimer's disease is not just memory loss related to aging. The best description I've heard of it is from Professor Wang at Princeton, who says, it's not about forgetting where you put your keys. It's about forgetting what the keys are for. People with Alzheimer's have a progressive decline in all of their mental functions, including memory, thinking, and understanding. In addition, they have changes in behavior. The following list of warning signs is available as a checklist on my website, drdonica.com, based on information from the Alzheimer's Association. If you or a loved one have two or more of the following signs, it's time to consult your physician. And that includes memory loss that affects job skills or activities of daily living, difficulty performing familiar tasks, problems with speech or language, being disoriented to time and place, meaning not knowing where you are or what time of day it is or what day it is, impaired judgment, problems with abstract thinking, frequently misplacing things or getting lost in familiar surroundings, changes in mood or behavior, changes in personality, and loss of initiative. Now, unfortunately, in most cases, people with Alzheimer's can't advocate for themselves, underscoring the need for caregivers and surrogates. Joining us in the ladies' room today to discuss this is Carleen Kelly, who's co-founder of SUNARiS Health, a marketing communications agency in New York. Carleen's love for science and how medicine helps patients improve their quality of life was the motivation for her to get started in the pharmaceutical industry. She has worked passionately in marketing, sales, and communications within the industry and around the industry for over 25 years. Prior to launching SUNARiS, Carleen was president of Surge WW Healthcare, a New York advertising agency. During her reign, the company won over 30 creative awards. She's worked in nearly every therapeutic category from small to large brands within the US, ex-US, and in all stages of a brand's life cycle. But her passion for healthcare is best exemplified by her volunteer work with the American Heart Association and with the American Alzheimer's Association. She joined the AHA in 2012 as an executive leader for the Go Red for Women initiative, and in 2013 and 2014 was the co-chair of the Go Red for Women initiative for Central New Jersey, raising over $600,000. In 2014, she was rewarded for those efforts by being appointed chair of the Central New Jersey Board of Directors for the American Heart Association. Since that wasn't enough, in 2017, she became a charity sponsor for the Alzheimer's Association, and she's focused on raising money for the TD Bank New York City Bike Tour, which is this weekend. And she's a primary caregiver for her mother for the past 11 years, who has Alzheimer's, which is what we are going to talk about today. Carleen, welcome to the ladies' room.
Thank you, Donica. I'm happy to be here.
Is this the first time you've done an interview in a ladies' room before?
Yes, it is.
So tell me, what was your
Hopefully not
most,
the last,
what?
hopefully not the last interview in the ladies' room.
So tell me, what was the most unique, interesting, different, or memorable experience you ever had in a public ladies' room?
Oh, I don't know. I think you might have asked me this one time during lunch, and I don't think I had anything back then.
Okay, well, it will be this interview. It will be this discussion. So anyway, tell us about your bike ride first, and then I want to talk all about your mom.
Sure. So I started this bike ride last year. I did it. I wanted to be doing something with the Alzheimer's Association, and I found out that I could raise money and participate in this. And I was amazed last year at how easy it was to raise money. And what I found is that many people were willing to donate because they have so many loved ones that have Alzheimer's. And so I finished last year, and as soon as I finished, it took 4 hours to do the bike ride. I said, I'm going to do it again. And I did it this year, and I think I'm going to surpass raising $2,500.
Great. Now, can people still donate?
Yep, they can still go to Facebook. They can go to my link, and they can still donate too.
Well, we'll put a link up on the episode as well. I think just about every family has been touched by Alzheimer's. In my family, my grandmother had Alzheimer's. And, it was what it's called is the long goodbye, because it's a very long deteriorating process. So I understand your mother was diagnosed about 11 years ago.
Yes.
So
And in fact, I think in fact, when we think about really how long she had it, we believe that she probably had it before we actually took her to the doctor and said that something wasn't quite right. And the things that weren't quite right were she paid the cable bill 3 or 4 times.
That's
We would
definitely
pick
not
up
right.
we would pick up a cushion and find mail underneath the cushion of a chair that she used to sit in the living room. And there were these simple things that were happening that just didn't seem right because she had been very aware of taking care of her checking account and opening up her mail and putting it in a certain place. Even cash we found when we had someone that was caring for her. The aide would say, your mother didn't give me the money, and we would find cash in another place.
Now,
Well, when we went to the physician, yeah, go ahead.
Just sorry to interrupt. Why did she have an aide at that point before she was diagnosed?
She had broken her hip,
Ah,
and so we had someone there that was helping her to get around and making sure that she was mobile as she had completed her physical therapy.
got it. Got it. And prior to
So,
breaking her hip, had she been living alone?
yeah, living alone, doing really well. And, she was, president of a senior citizens group in Weehawken, and she planned all these events. So, it's interesting to see how she was really coping with this because she must have been suffering at some point to know that her mind wasn't as sharp because she was still doing things that made her appear that she didn't have it, which is why we look at it and say she fooled us for a while that, we didn't realize that she had it.
Well, also, none of you were living with her. So I think until you had the aide who was there, on a regular basis. And, just as an aside, did she break her hip because of osteoporosis?
Yes. Yeah,
Okay.
because of osteoporosis.
So, of course, with people with osteoporosis, this is a very common story because 20% of people who break their hips from osteoporosis will never again live independently. It's sort of the beginning of a downward spiral. And of course, of people in that age. And what age was she at that time?
So she was 9. So she was 79.
Okay. So people in that age group very commonly have more than one diagnosis. That's very common. Now, in your family, I know you have a bunch of siblings. How many siblings do you have?
I have 4, so there's 5, and I'm the youngest daughter and the number 4 out of 5.
Okay. And are you the
And,
close?
that was the very, yeah. So I was the closest with my mother. Being on the younger end, she had a little bit more time as I became a mother and a career professional. My mother was really good about helping to care for my son so I could travel and just not have to worry about leaving my son behind. So she was just, very supportive. And we did a lot of shopping together and going out to dinner. And, we had just such a great relationship. And it was hard then to get this diagnosis and to learn over time, how things were going to change for us.
So you said once she was diagnosed, you and your siblings felt retrospectively that, you could think back and she probably had evidence of it before. So tell us about that.
Well, the way that now we look at about how she would handle things. Um, for example, my brother and I often speak about just getting painting done in her house. If we brought someone in for her, all of a sudden she would say, "This is my house. Why are you bringing them in?"
Mhm.
And she wasn't like that before.
Mhm. So you
And,
felt personality
little
change.
arguments. Yeah. And we started to compare when we would speak with her at nighttime. And my siblings and I would call her. She would get calls a couple times during the week from us. And we started to compare the conversations like, "Oh, I haven't spoken to you, Sister Kathy." And meanwhile, my sister Kathy had just called her the night before.
Mhm.
So we started to compare some of these things and said, wow, maybe we need to have her looked at by a physician, and we took her to a geriatrician to have him speak with her and see what he thought.
Okay. So most people don't even know about the availability of geriatricians, which is a fabulous specialty. A geriatrician is somebody who's trained in internal medicine or family practice, but who specializes in all issues affecting people, who are older. And technically, that used to be people who were older than 65. Now it's generally people who are 80 and up. But basically, any of these diseases of aging, and certainly Alzheimer's is one of them. And what was involved in making the diagnosis once you took her to the geriatrician?
Yeah, so when we went there, he asked her simple questions. And he would say, "I'm going to ask you 5 questions, and then we're going to speak a little bit, and then I'm going to ask you to answer those questions again." And she was 79, at the time, and some of the questions I thought were actually a little bit hard, for her to even answer. I mean, every day to her could be the weekend, right?
Right.
Because she wasn't up working, and
Mhm.
she watched TV for the news. She didn't read the newspapers. So, to ask us a date like, "What's today's date?"
Mhm.
I don't know if it's June or July. I mean,
Mhm.
so some of those questions, I looked at the physician like, wanting her to fail, like, because it was a part of me that didn't want her to fail.
Right.
And then, who was our last president, and she would look at me and, you have this sense of, "Oh, mom, come on. I'm here for you. Like, you got to get it." And you start to realize that, she really doesn't. And then you say, "But how do you really know it's Alzheimer's? How do you know it's not just, she forgets,
Right.
And
Or
so,
she could have any other memory problem or any one of a number of other forms of dementia, because there are many forms of dementia. Alzheimer's is just the most common. So the list of questions you're talking about is generally referred to as a mini mental status exam. And usually in the emergency room, we usually only use 3 of those questions. In the emergency room, we usually say, do you know where you are? Do you know the date? And do you know who's president? I don't know how we got into this president question. But anyway, one time when I was a
Mhm.
resident, I was walking through the emergency room and this older woman asked, she said, "Are you a doctor?" I said, "Yes." She said, "Well, can I ask you a question?" I said, "Sure." She says, "What day is it?" And I told her. And then she said, "And where am I?" And I told her. And then she said, "Who's the president?" And I told her. And it occurred to me she was trying to cheat on the mental status exam. But what I thought was so fascinating about that woman, she didn't know the answers to the questions, but she clearly remembered all the questions, which is very interesting about Alzheimer's, is that you can remember certain things, and not
Mhm.
other things. Then I had another patient, not too long ago. Actually, somebody else told me about this story, where they went through and they asked the questions and they said, "Who's president?" And the guy said, "Eisenhower." And everybody was very concerned because it's been a few years since then. And we're all, then we started asking him all kinds of other questions. He's like, no, I was just kidding. I just haven't liked any of the presidents since Eisenhower.
That
So
was
he hadn't lost his sense
really
of
fun.
humor, at least. So what other personality changes did you notice in your mother in the early day? And now it's been 11 years, right?
Yeah. I think in the beginning it was a lot about paranoia.
Mm.
And I think the ability of her to know that we were finding out, that, we were now understanding. And I felt that she became afraid then about who she could trust. And am I, questions you could start to surface were, am I going to be able to stay in my own home? I want to stay in this house. I want to die in this house. And, you know, um, I hope you're taking care of my money. And, one of the other siblings doesn't get any part of it. This
Hey.
paranoia was really hard in the beginning to deal with.
Mhm. So did you and your siblings pretty much function as a team, or were there disagreements, or did you have a situation where one or two lived really far away and were not able to participate?
Yeah. I think the hardest challenge we had was the second time that she had broken her hip or her groin. At that point, I felt time to put her into maybe an assisted living, and my siblings basically said, "No way, she wants to stay at home." And it took a major investment of having to get out her basement and make a place for someone to stay overnight and care for her. And we did that, and she really only lasted a year,
Hmm.
when then we had to put her in a home. And then that became, well, she's from Scranton, Pennsylvania. Maybe you should put her in a home in Scranton, Pennsylvania. And my sister in Charlotte said, there's a really great Christian place out in Pennsylvania, like in Bethlehem. I have friends from here that their parents are there. Go put her there. And at the end of the day, knowing I had power of attorney and I had to care for her, I thought, oh my gosh, if she has to go to the hospital, that's an awfully far place to go. And just because she was going into a home didn't mean I wouldn't go see her frequently.
Mm-hmm.
So that was hard because everybody then became concerned about, where she was going. So that took some time to get everybody on the same page to say, let's think a little bit about the objectives of, going in a home, but then what else do we want from this? And then that took probably going to see 10 homes
Mm-hmm.
and crying after leaving, so many of them saying, I just can't put mom in this place. But my siblings, I'd call them and they'd say, all right, it's just not the right one. You're going to find it, Carleen, keep on going.
And this was
And
all 11
the last one that
years.
yeah,
And
yeah.
so are they living far away, or they just weren't involved, or you volunteered, or you got voluntold?
Yeah, I think they felt, because I have experience in healthcare for so long, they trusted that I was going to ask the right questions. And I still feel at the end of the day, a lot of them were still upset at where mom was,
Hmm.
that it was very hard for them to acknowledge that this was really happening.
Do they live in the same
So,
state?
yes, well, I have one sister lives in Nyack. My brother lives in Weehawken in New Jersey. I have a brother that's in the beach area, and then one in Charlotte, North Carolina.
Okay, so that's
But yeah, so I mean, they gave me a lot of support. But I basically did all the interviews, for which of the places. And the last one that I went to, as soon as I walked in, I knew that this was it.
that's great.
So it was a great place. She's been there. She'll be there 3 years in July.
Okay, so
Yeah.
she was first in her house alone, lived independently, then had a caregiver, and then went into the assisted living place. And how has she done since she's been in the assisted living place?
She's done really well. In the beginning, she was on the weller end of the spectrum. There were some in the home at the time that couldn't speak. They were bedridden.
Does
So
everyone in this place have Alzheimer's?
Yeah, Alzheimer or some form of dementia, and there's only 12 residents that live there.
Oh, wow.
Um, yes, it's a nice area because the caregiving with the aides is very good. That they know the residents that are there, and it has allowed my mother to have a conversation and to be her own person with these aides, and they get a kick out of her, because every once in a while she'll not be in a good mood and she'll tell them off, but they know who she is and they kind of go along with it and they laugh and they get her out of whatever mood she's in. So she's done well. Now I look at her, she's not on the far end of in terms of where she was well on the far end. She's really more in the later stages of Alzheimer's. So we're probably coming to more near the end. And a lot of it has to do with she has COPD, which now she's on oxygen 24/7.
Okay, so COPD, for people who don't know, is chronic obstructive pulmonary disease. So this happens very often with people with Alzheimer's. They certainly are aging. They develop other conditions. We call those comorbidities. And we do know that most people die within 10 years of being diagnosed with Alzheimer's. So your mother's already beaten the odds, on that end of the spectrum. But I'm really sorry to hear that she's got this additional cardiovascular pulmonary condition on top of everything else. One of the problems too is obviously people with Alzheimer's, especially when they go into an assisted living place, they just become much less physically active. So that also contributes to, a lot of other additional illnesses. Was she a physically active person before she got sick?
She was always on the go, always on the run, very social, so I think it was nice being in a group because there were some women that she could try to have a little bit of a conversation with. But on weekends, we would take her out for lunch or for dinner. I think the most important thing is being there to be with them. And it does take a little bit of a mind shift to say it's their world, and being accepting of that, and figure out what is this new life for you going to be like, and how can you have a good time with them. So my siblings and I have the sister in Charlotte. She comes up every month for a weekend, and she'll be with my mother like 8 hours a day on a Friday and a Saturday and a Sunday. Like, she's really all in, and then it gives me a break for that weekend. So I think it's really important that even though they're in a home, that you're there visible with them, because they know. And I think that's probably one of the reasons why she has done well, is because she knows there's a lot of love and support that's there for her.
That's awesome. And does she still recognize you and your son and your sister, and know your names and know who you are? And
I would say just within the last 6 months, she knows I'm family. So every once in a while, she'll call me her sister Beverly, and I'll walk and she'll say, "Beverly, you're here. I can't wait to see you." And then I'll say to her, "I'm not Beverly, I'm your daughter." And for the longest time, she knew I was Carleen. And now she'll say, and she'll have a look in her eye, and she'll say, "You're either Kathy or Carleen." And I'll say, "All right, that's good. I'm Carleen." And I think that is making them feel comfortable, that they can make that mistake is a good thing too. So, and then, she'll pick up my hand and she'll say, "Oh, I love you so much."
So do you and your sister physically resemble each other?
A lot, yeah. And
Okay.
we still sound alike, even though she lives in Charlotte. She didn't pick up, any different accent down there. We still sound very much the same.
Okay. And what about you and her sister Beverly? Do you resemble each other physically?
No, and she's been deceased probably about 20 years. So it's funny how, she still thinks about her.
Well, I mean, do you resemble what Beverly looked like when she was your age?
Yeah, I don't think so, but she thinks so. So
Well, I think anytime a loved one passes, if you're not consciously thinking of them, they're certainly subconsciously thinking of them.
hmm
Yeah. And she
Yeah.
probably has a lot of time on her hands to think about things. But
Yeah,
we
for
also
sure.
know that the way memory works is very often they forget the more recent things and have better recall on things that are from 20
More
years ago,
distant.
30 years ago, 40 years ago. So what
Yeah.
else have you
Yeah, that
noticed?
I think the other thing that is important is, when they go to the hospital, you, as great some of the hospitals are, I don't find that everyone is all skilled in taking care of someone with Alzheimer's.
Mhm.
So from, the moment you go into the emergency room, it's important that someone is there to give them the history. Because even though the home will supply the information, there's nothing like having someone right there to say, she was just here last year, this is what happened, this is how long she stayed, because, time is everything when you're in the emergency room.
Right.
And then even when they, go into the room, they're admitted, being able to be there to eat. It's one thing that they can eat in the home when they're sitting at the table and they're surrounded by what they're used to. But now when they're sitting in a bed and they're trying to use the fork and pick up the food, it's very hard for them to eat in that setting, in that environment. And let's face it, hospitals don't have as much nursing as they used to. So, the opportunities, they may not eat unless you're there. I mean, they try to do the best job as possible, but no one's going to care for your parent or loved one as the family will be. So, that to me was kind of an eye opener of making sure that you're there with them for at that time. And in particular, in the beginning of Alzheimer's, they don't even want to stay in the bed. They want to rip things, off their arms. That early on, when she would have deep vein thrombosis, blood clots in her legs, we would pay for an aide to be there with her,
Mhm.
so that she wasn't locked down, or tied down, that, someone was there to say, no, 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 you need to keep this on your arm, you're okay. So in that beginning part, that was very hard to keep her stable in the bed.
Right, right.
And
That's when she was living alone. Was she a wanderer? Did she leave the house and wander around the neighborhood or any of those issues?
no, and she would go to sleep and she would be out until the morning. The part that became concerning was, she had these beautiful windows in her home, and they were casement, and they would be open, and she'd be screaming, help me, I need help," and the aide would be sitting right there. And the one time, somebody outside called the police department, and the police came and they knew our family, and they said, "Oh, Mrs. Kelly, how are you? Is everything okay?" And why, what are you doing here? She responded to the police officer, and they said, "Oh, well, somebody were being hurt." And that was the point where we said, we probably need to move her into a home, because we didn't want the neighbors to see our mother in that way when she had been such a different person for so
Right,
many years. And we didn't want them to know that about her.
right,
So everyone has to figure, what is that trigger point of when it's time to move their loved one into the next stage.
right. Now, speaking of stages, we're kind of approaching this in a very haphazard. We're doing the end from the beginning, but in the beginning, did you have any issues with your mother? I know one of the things that a lot of people have issues with, and we had this with my in-laws. Did you have issues about taking away her car keys or keeping her from driving?
Yeah, that was a very big issue. And sometimes I think that when we took away the car keys, the dementia happened faster
Hmm.
because she wasn't out there. So we had to do it, but it also made us start to realize that she declined faster, because
Right.
she wasn't getting out with friends as usual. That was hard. We had to hide the keys. And we finally got to the point where she actually gave her car to neighbors down the street that really needed a car, and
Well,
she
that's
gave it to them, and she had
wonderful.
a nice, it was really very nice. It was, if I can't drive it, I'd like to give it to somebody then that really needs it.
Well, that's
So, but that
wonderful.
that was hard. Yeah, yeah,
That's actually, I have not heard that story before. But that's wonderful. It's
yeah.
interesting. I hear a lot of stories, and we did this with my in-laws too, this issue of hiding the keys. as opposed to just taking the keys and just taking them away, which of course we eventually had to do. I think that, there's so many issues here. And of course, people who are listening are at all stages of dealing with this with their loved ones. Some people have already been through it. Some people are just at the beginning. For those people just at the beginning, though, what are the best pieces of advice that you have from sort of the been there, done that perspective that you would advise people in terms of either taking care of a parent or a spouse or another loved one?
I think first, if you have siblings, making sure that they're all engaged with you on this topic and that they all have a voice. But you also have to be very careful because not everyone can deal with their parent going through this stage. And you have to let that sibling have that emotion and go through what they're going through, because not everyone can do it. But that doesn't mean that they can't help to do something in terms of whether it's the grocery shopping or something, even if it doesn't mean taking care of mom. They should feel that they have to help whoever is the caregiver.
Mm-hmm.
But I think just letting everyone know that you're not all going to be expected to do the same thing, bathe mom or whatever, that, let everyone have that opportunity to help in the way that they can and not be judgmental to that.
That's awesome. And I think from the healthcare provider perspective, or from the nursing home or assisted living home perspective, I think one of the challenges when you have big families, and I've got you beat because I have 5 siblings, but it's always making sure that one person is the spokesperson for the family. I know it's very difficult for assisted living facilities or nursing homes when they get calls from 5 different people wanting a regular update or wanting to give input on the situation. Even, with my in-laws, there were 4 siblings in that situation, or with my grandparents, there were 4 siblings. And, that was with my grandparents, there were 4 siblings. And then my mother always wanted me to call because I was a doctor.
Right.
So I don't know, I think my mother thought they were going to give me some secret information that they wouldn't give a layperson. So, I don't know what good it did, other than for them to say, could you guys just figure out one person who's going to talk to us? And then on that same line, do you have advanced directives, and have you all been on the same page as far as end of life issues? Have you discussed that?
Yeah, my mother was, very smart in terms of she put all of that, she had all of her paperwork done, which
Oh,
made
great.
it easy for us. In one of the last times that she was in the hospital, they wanted to use a feeding tube, and my one sister was just so upset by that and said, you know, we're going to have to do it. That's what they want. And I said, you have to go back and read mom's medical directive because that is not what she wants. So we have to look at alternative. And I just saw my sister melt. And I said to the physician, can we come back to you on that? And so we came back here that evening and I shared the medical directive. And it was very hard for it still makes me feel upset over that because she, it was very hard for her to handle that. And luckily we went back the next day and she didn't need the feeding tube.
Oh.
She started to do better and she was speaking better. And we had a different speech pathologist and she said, no, I think she's going to be okay. It was probably the seizure that she had. It's she's evolving out of it and she didn't need it. So thank God that it didn't happen at that point in time. But that was, a very serious time because, everyone has their time where they say, I'm ready to see mom go,
Mm-hmm.
and for siblings, it's never going to be the right time. But when your parent has something in writing and they thought about it when they had full conscious, you have to, go by what they wanted. So, that's
I think that's
not all siblings,
Yeah, I think that's a really important public service announcement for everybody who's listening, to not only put those things in writing for yourselves, but to speak to your parents, when they are relatively healthy and when they have, full mental capabilities, and to let people know you can always change your mind. Just because you put it in writing now does not mean that's going to be the same answer 30 years from now. But But I think also it's really important for family members to have those difficult conversations with each other before it's necessary. Because many times, especially if it's a DNR directive, a do not resuscitate directive, you don't have time at that point. The healthcare team has to make that decision in the moment, and they need to know what the family's wishes are and what the person's wishes are. I think one of the other issues that has become a real concern amongst people with Alzheimer's is when they have cardiac problems. Not just do we resuscitate them, but do we do invasive things like put in a pacemaker, for example. And this has become a real ethical discussion, because very often one way that people with Alzheimer's pass is because they have a cardiac arrhythmia, and they go peacefully. But if they have a pacemaker, that extends their lives for could be another 10 years. So
Sure.
we had that issue in my family as well. And again, in that case, all the siblings were not on the same page.
Yeah. Well, one example is again getting back to when she broke her hip. She clearly was in the hospital and kind of like not really with it. And two female orthopedic surgeons came in and said, "Oh, we're going to do your mom's hip surgery today." And I said, "I don't think so." And they said, "What do you mean?" And they're looking at two women that have mothers, and they're thinking, "I'm just going to go along with this." And I said, "She's not going to be able to do physical therapy right now. She can't follow directions like that." And "No, it's okay. We'll get her up and going. We can do this." And I said, "I think you have to go read her medical directive." I said, "I think we've pushed the boundary of, what's right at this point." She was 87 maybe at the point. I said, I don't think that this is the right time right now.
Mhm.
And they made me feel so horrible. And I remember calling my siblings and they said, "No, Carleen, you're right. We've been through this before with her. And even when she was weller, it was tough to do the physical therapy. Now where she is, it's going to be even harder, and they'll be pushing her out because the Medicare timeline that you have for them to only staying in a nursing home wouldn't be enough anyway." So luckily, her orthopedic surgeon who had operated on the other hip had said, "You know what? Let's get her back in her home. Let's have her eat. Let's get her feeling as best as she can. Bring her in. If she needs a surgery, I wouldn't mind scar tissue there. And we'll do it at that point." And what happened was we didn't need it. We went getting physical therapy that went right to the home.
Great.
And that actually helped her to walk with a walker. And we didn't have to go through the surgery, which can be tough for a patient with Alzheimer's at that stage.
I went to visit a assisted living facility once, and at this place, it was very unique. They automatically gave every single resident a walker, whether they needed it or not. And they said, "You're just having this in your room, and if you want to use it, you can. If you don't want to use it, you don't have to." And this was a facility where everybody came down to a common dining room. And they found that most people wound up using the walkers, and their incidence of hip fractures was dramatically reduced just by giving them the walker instead of waiting till after the fact to give them a walker, which I thought was brilliant
Mm-hmm.
and just
Although
really.
I will say, when my mother was well, before she, maybe it was about the time we had the first aid, I took her to see one of these homes and said, "I just want you to look. There's a couple of them. I want you to see what they're like and see if you have a preference."
Mhm.
And she walked in, and she saw these women with walkers and wheelchairs, and she cracked up crying. And she said, "I've given you power of attorney, and you are going to have to make this decision for me if I become that I can't make the decision." She said, "I can't do it." And we left, and she was just shaking and crying, and I felt terrible. But to me, I realized this was just one thing she was not going to decide for herself. As good as she was in terms of all the plans that she had laid, that was just not something that she felt comfortable with. But she knew that we would, pick the right place for her when it was time.
And you clearly did. And it sounds like this
Yeah.
place is really working for you. And I think we didn't make it clear in terms of the selection process. You eventually chose a place that not only met your needs in most ways for her and what you wanted for her and being a small place, but it's fairly close to where you live, which, I think is probably
True.
the number one success factor, because it allows you to be there very frequently, which, as you said, is probably
Yeah.
the best thing for her. Anyway, in the beginning of this, in the intro, I gave a list of, like a checklist of all of these criteria for people that if their family members have these things, it's time to see a doctor. I just want to go through the list with you and see which are the things that your mother had at the very beginning, which you would have checked off on this list.
Mhm.
So, memory loss that affects her activities of daily living,
Yes.
difficulty performing familiar tasks,
Yeah. Paying bills.
yeah, problems with speech or language,
Uh, Memory. I don't know that she forgot any. Yeah, she would say she would have trouble finding the word.
right? That's called word blockages. Well,
Yeah,
we see that
she
often
would
with
have
people who,
word.
after they have a stroke, or they'll say something like, "Oh, I know what that bird is. It begins with a P," but they just can't seem to get the word out. What about being
Yes.
disoriented to time and place? So not knowing where she was, what day it was, what time of the day it was.
Not to the place. Oh, to the place. Yes, she did. She would say, "Take me home," and I would say, "You are home," and she would
Mm.
say, "This is not my home." My mom, this is your home. You've been here for 59, 56 years.
Oh,
So yeah, so she was disoriented, at nighttime more like later in the day that was not her home. And
right,
then, the date, I just never got that concerned about that because since she wasn't working, every day is Saturday or Sunday, it was kind of hard. She
right.
would know the season, not necessarily the month too.
Yeah, I love that on cruise ships where they have the day of the week on the carpet in the elevator every day, because otherwise I would not know what day it is. You said she
Yeah.
had impaired judgment. What about problems with abstract thinking?
Yeah, I think sometimes watching television, she would say, "I didn't follow that. What just happened there?"
Right.
So sometimes she wasn't able to connect things in simple shows. So you'd have to stop and then talk about it, and then you would miss the next part of the TV. Or yeah,
Yeah, I remember that with my father-in-law. He was such a diehard Vanderbilt sports fan, and Vanderbilt's football team was fairly weak for most of his life, but he was still a diehard fan. And then one year, when he was finally had Alzheimer, well, he had another form of dementia, and he was in a nursing home. And Vanderbilt that year had this amazing team that had this incredible upset victory over one of the top teams in college football, and he couldn't even appreciate what had happened. Like he couldn't even follow the game from one minute to the next. And that really broke my
hmm
heart. What about frequently misplacing things or getting lost in familiar surroundings?
yeah, I didn't really notice it too much because she basically was home,
Hmm.
and we would go to the mall. I'd be with her directing her around. So I didn't really notice that, but I don't think I was looking out for that.
Right. And you did say changes of mood and behavior was the hallmark, and changes in her
Yeah.
personality. And then finally, loss of initiative.
Yeah, not caring to go see her friend Mary, or she had a friend, Mrs. Kelly too, Margaret Kelly.
Mhm.
She stopped wanting to go see them, and they had been such a big part of her life for maybe like the 10 years previously after she had retired. She had this circle of friends where they would go to church, then they would go to the diner to eat. They would go to Atlantic City. They drive in the car. I mean, they did a lot of fun things together, and even saying that, well, we'll take you there. And she just did not want to participate with that.
Mm. So she basically checked almost every box on the list. So I
Yeah.
think, the net from what we've discussed is it's important for family members to be aware of these things and to try to get medical attention sooner. Now, when she was diagnosed, was she early enough to be able to be put on any of the prescription medications that can delay the course of the illness?
Yeah. In fact, she started on Axert and later on moved to Exelon, the patch. And I felt that I could see the difference with her on it. And,
Mhm.
there's a lot of discussion about do they work or not. But when she went into the home, they try to minimize the number of drugs that they're on. And they took her off, and I could tell that she was not on it.
They took her off
So
without your
I do,
permission?
yeah, they wanted to see how the medications were because they believe that many patients are over medicated.
Well, and that is true,
And
but don't they have to clear medical decisions with you?
yeah, maybe they did say something at the point in time they were going to try it, but I don't think that they did because I went to them and said, she seems to be different. There were certain signs. I think she was more agitated, maybe. And they said, oh, well, we tried to take her off. The physician took her off of the Exelon patch and we'll put her back on it again.
Mm.
So,
Well, I
yeah.
could talk to you
So I
about
did.
this. I could talk to you about this all day, but we're running out of time. So just in conclusion, what's the one most important thing that you want everybody listening to know about Alzheimer's and caregiving?
I think just that be the caregiver that's going to have the voice of that loved one, and just make sure you try to do your very best for them because they can't. And it's very hard to have whether it's a physician or a nurse or anyone else to have that same level of care because they're just dealing with it like every other patient, and there are some nuances to how patients present themselves. So just try to be the best caregiver and just try to put your best foot forward for them, and they'll be fine. You show them love, they're going to feel it.
Well, can't think of any comment better to end on. And quite honestly, I think that we all do better when people we care about show us love. So I think that's a really, really important message. Anyway, thank you so much and good luck on your bike ride on Sunday. Of course, we didn't even get into issues about Alzheimer's prevention, but of course, participating in regular aerobic exercise is one of the best ways of reducing your own personal risk of Alzheimer's. And I don't know too many people who do that better or more diligently than you do. So good luck with that. Good luck with your last ditch fundraising efforts, and tell everybody where they can go one last time to help you with that.
If they go to Facebook, Carleen Kelly on Facebook, Carleen Kelly, Kelly. You'll see I have a Facebook page, and there's a link there, and you can just donate $5, $20, whatever you feel comfortable with. I think I'm only $250 short of reaching my goal, but I still have about 30 more people that I'm expecting that will be donating. So I'm sure I'm going to get over the $2,500. So
great. We'll have a wonderful, wonderful ride, and thank you so much.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.